Okay, so we welcome everyone to our grand rounds today. We will go ahead and get started since it's 5 minutes after the hour, and we appreciate the effort of everyone to make it. And I know more people will be joining us as usual, so we'll get started. So let me welcome Miss Lindsey Grovenstein to our grand rounds today. Ms. Grovenstein is going to speak to us on the topic of refugee resettlement, welcoming the world's most vulnerable population into the city of Savannah. And she is the community engagement specialist at Inspiritus Refugees and Immigration Services in the area. And if she wants to say more about herself, I will let her do that. So without further ado, I'm going to turn the presentation over to Ms. Grovenstein, and we'll take it from there. You have presentation access if you need it in terms of slides.
Beautiful. Thank you, Dr. Telfair. I really appreciate the opportunity to share this work. I'm always really happy to talk about it, but particularly, to the work that y'all are doing in public health. I think that you will learn a lot from it. Yes, and I apologize ahead of time. I think like the pollen's getting to everybody, so I'm a little congested, but I'm excited to do this. So let me share my screen and just jump into the work here. What I will be covering, refugee resettlement is a wide world and there's a lot to cover. I've been doing this work now at Inspiritus for 1.5 years. I did not have experience beforehand doing refugee and immigration work like a lot of my colleagues did. My bread and butter has always been community engagement, talking and networking and building coalition and volunteers, like that's what I do. And so I've really have learned so much, and by no means an expert, but I am really excited to talk to you about the work of refugee resettlement, what we do here in Savannah, and perhaps how you can get involved with the work that we do here. And so while I have you, we will have time. So basically the agenda for this will be, I'll talk about refugee resettlement from a kind of a global perspective for a while, and then I'll narrow it down and talk more about like what specifically do we do here in Savannah. And then there's some time for Q&A at the end of this. And then of course, happy to share my information if you want to stay involved with the work that we do. So I'm not the best at titles, and after I came up with this, I was like, well, by definition, the refugees that we resettle are the world's most vulnerable, but they are so much more than that as well. But I just want to, of course, say that. So Inspiritus, which we are formerly Lutheran Services of Georgia, and some folks may recognize us by that name rather than Inspiritus, but even though the name changed, our mission remains the same, which is that we guide individuals and families on a path from surviving to thriving. We empower those whose lives have been disrupted to discover their strength and resilience, accompanying them as they grow into vibrant contributors to their community. I like to say that in Inspiritus, the work we do here, we are just a twig on the tree of resettlement and immigration services. It is a big, wide tree. There are many global players. We are part of a global humanitarian effort here. In the US government, we are a big branch on that tree. So just a little glimpse into the hierarchy. In Inspiritus, we are an affiliate of Lutheran Immigration and Refugee Services. In the United States, there are 9 major resettlement agencies involved with this work. And each of those agencies have many different affiliates like us across the United States doing the work of welcome. And we all report to each other, and we report to the United States, and the United States works with the United Nations and other nations across the globe to do this work. So who do we serve? We're actually, I'm happy to say, expanding our services. So in Inspiritus, we are refugee and immigration services. A lot of what we've been doing this past year is refugee services, and we are now expanding immigration. I won't talk much about that, but we are involved with unaccompanied minors and connecting them to sponsors in their family. And that's a new program of ours that we're excited to expand and to expand other immigration as well. Because often we get referrals to clients that we haven't been able to serve in the past who do not have refugee status, because refugee is a very specific status. And in the world of immigration, there are many different statuses and classifications and such. So we're expanding that, but this presentation will be really focused on refugee services. And so who is a refugee? As defined by the United Nations, a refugee is someone who has been forced to flee his or her country because of persecution, war, or violence. A refugee has well-founded fear for persecutions for reasons, and these reasons only: race, religion, nationality, political opinion, and membership of a particular social group like LGBTQ+. Most likely they cannot return home, or they are afraid to do so. And of course, war and ethnic, tribal, religious, and political violence are leading causes of refugees fleeing their countries. Like I mentioned, there are many classifications in the world of immigration. This is just a snapshot of other legal classifications for people who've been forced to flee their homes. I won't stay on here long, but I just think it's important to give like the context to the work. And unfortunately, I have to acknowledge that immigration is a hot topic, and it shouldn't be. And I hope that this presentation, in the least, I hope that you want to get involved with the work of welcome, of course. But I understand we all have different capacities and time, and we can all be advocates though. We have welcomed enough people, and I'll talk about numbers, that even if you're not volunteering, you have interacted with these people, and there's so many, just that we can do the work of welcome even indirectly. And so I just hope that kind of spurs, because it shouldn't be a hot topic or politicized to divide people, because this is about human beings and life and dignity, and we're a part of this now. So I think it's important to know that every refugee was once an asylum seeker. And an asylum seeker is someone who is requesting sanctuary, but they are being processed. So someone will flee their country, and they seek sanctuary in a second country by going to their border and applying for asylum. That's the way to do it. And asylum is the right to be recognized as a refugee and receive legal protection and material assistance. Asylum seekers have to demonstrate their fear of persecution, that it's well-founded. They have to prove it, and go through many interviews. And to get refugee status, it has to be for those 5 reasons, and those 5 reasons only: race, religion, nationality, political opinion, or membership of a particular social group. Rising climate change and economic reasons are another reason for forced migration that doesn't receive as many protections. I can go on and on about that, but I will stay on topic. Other legal classifications: internally displaced people, and these are people who do not have homes but have not crossed a border, and they're just internally displaced. There are stateless people who have had their nationality stripped from them. And in a world where you have to have documents to do anything, they're also stripping them of basic access to rights and their humanity, essentially. And there's also humanitarian parolees, which is a temporary status, which I'll talk a little bit more about later, because we are now dealing with a few parolee statuses. As of May 2022, 100 million people have been forced from their homes. The year before, 2020 or 2021, it was 89 million. At the end of 2022, as soon as they came up with a statistic in June, in the summer, there were floods in Pakistan, which displaced 3 million people. So now the toll is 103 million people in 2022 alone have been displaced from their homes. A lot of that, of course, was the Ukrainian crisis that we saw. but there are other nationalities that continue to be displaced from their homes. And you can see from this graph that there is a clear trend of global displacement, and it's just going to continue. And so again, I think we have to, as a global community, really think about what our response to that is. We are doing good work, but there's a lot more that we can do. So each year, the United States creates a determination for how many refugees we will allow into the United States and access to the resettlement program. The Refugee Admissions Program has been in existence since the 1980s, and it's always been a bipartisan endeavor. As you can see there, it kind of has gone back and forth, and unfortunately, the previous administration was not as immigrant friendly. And then, of course, with COVID as well, it's just admission rates steadily declined. And this administration, we have the cap is now trying to make up for that, is at 125,000 that they're trying to welcome into the country this year, which is wonderful because a lot of people have been waiting. I mean, if you get to the point that you are to refugee resettlement, which we'll talk about, you have waited years and years and years and years to get to this point. Where are people coming from mainly? So to get through this whole process, to prove that you're eligible for refugee status, we see that this comes from certain countries that are a part of this program. So as you can see, 67% of refugees originate from just 5 countries of origin. And of course, there are other populations who are eligible for that, but just because of, everything is very precise in how it goes about. So you can see Afghanistan, Burma, Colombia, the Democratic Republic of the Congo, etc. Those are a lot of the places that we are seeing refugees coming from. So we've been doing this work in Savannah since 2012. I forgot to mention, so we're in the city of Savannah. We have a main office in Atlanta, and they've been doing this work for a lot longer, for a few more years than that. Atlanta actually has 4 resettlement agencies, and so they're doing wonderful there. If you've never had a chance to visit, there is a part where they resettle a lot of the refugees, and it's actually the most diverse square mileage in the United States. I recently had the honor of visiting, and it was just beautiful to see. It's called Clarkston, and it was beautiful just to see the global community and how connected it made everybody feel, And we're working on that here in Savannah. I think we all know, if you're in this field of public health, that access to services can be a challenge for everybody, and it's something certainly that we experience. So I bring up the refugee admission because, as we know, with government funding, it goes up and down depending on support. So because there was a low refugee admission rate, there was no funding for our programs. And so unfortunately, even Lutheran Services at the time had to let go of staff because there was no money, because there was nobody coming in. And so, as you can see, 2016, we welcomed 102 refugees into the city of Savannah. And from there was a slow decline of refugee admissions. In 2020, we welcomed just 5 individuals, 27 in the year after that. And so when the Biden administration took over and there was more support for the refugee admission rate, there's more money. And so they started, I started a year and a half ago, and basically all of my colleagues started at the same time. Thankfully, they had more experience in refugee services, but it was a tough time because when we started, we were also welcoming the Afghan allies who were evacuated August 2021. And they were here on they were here what's on called the humanitarian parolee status, which is an emergency program. So last year, we welcomed over 140 refugees into the city of Savannah. I know, it's in the majority of them came from Afghanistan, and they were Afghan allies who served in our military or served with our military. They were interpreters, they were soldiers, they worked in the kitchens, that's all they knew for 2 decades. And their families were put at risk because of that. And many escaped with their families. There are many who didn't and are here by themselves. And we were, I talked to my colleagues who had been working in refugee resettlement for decades, and they said they had never experienced quite the rush because they were evacuated from Kabul and taken to Germany to be processed, and then they were taken to our U.S. military bases to be processed. And their goal was to start in August and to have this all done by March. And of course, we were still welcoming people after March, but it was just this very quick process because they were also welcoming them in the middle of winter, and it was just like, we have to get these, we have to get the Afghans resettled. And so over 76,000 Afghan humanitarian parolees, Afghan allies, were evacuated and resettled into the United States last year. And what a feat it was. And it was a quick emergency response. And let me tell you, it was a time to I was brand new to the work of resettlement, and I got the crash course in it. And it has been life-changing. And so I'm going to start talking here soon about what we actually do. This has been more of like a, how did we get here? Global perspective, but what does the work of welcome actually look like? And welcoming and working, what a time to get involved with this work. And the key to the work that we do with resettlement is that we cannot do it on our own. We rely on community support, on volunteers to work with us as cultural mentors and friends in the work of welcome. And I was astounded at the response from, especially, I think the refugee crisis always, it tugs at people's hearts, and the Afghan evacuation really, it was a string in it, and people were just, how can I help? And people are like that now, but I don't get as many calls as I used to. So I'm, again, really happy to be sharing this work, because I think that before I started, I had no idea we were welcoming refugees into Savannah. And so I think when people know, they do want to get involved with the work. And so what is the work of refugee resettlement? Resettlement is the careful selection and transfer of the most vulnerable refugees from a country that they have sought protection in, the second country, and the third country whose government has granted them lawful admission. It's a solution that ensures refoulement, against refoulement, which is the forced return, and provides refugees with access to rights like those enjoyed by citizens, and gives them eventually the opportunity to become U.S. citizens. And I haven't had the pleasure of attending one of those ceremonies, but we have had a few, and I can't wait to be part of that celebration. And they have to be here for 5 years, and then they can take the test. And so it's beautiful. 5 things to know about refugee resettlement. I get a lot of questions about it, the process, how people get here. Something important to keep in mind is that refugees do not apply for resettlement themselves. When they apply for refugee status by going to a secondary country, most will live in their secondary country. Less than 1% of refugees are ever resettled. The majority will live their lives in the secondary countries. Of course, we see refugee camps. There's also integrated cities, which is the model people are trying to go to, which the trouble is they kind of be more segregated than integrated, and we're working on that. Again, it's a worldwide effort that we're a part of what the solutions are. But resettlement is the very, very last option, and most refugees will never get the opportunity for that. Resettlement is for the most vulnerable refugees. They must fit at least one vulnerability category, some of which include high medical needs, children at risk, women and girls at risk, and survivors of violence and torture. So once the UNHCR, the United Nations High Commissioner for Refugee, Once they identify cases, they will then present them to the third countries, like the United States, like Germany, like Canada, anybody who's a part of this program. And then the individual governments will then go through it. So our government will then conduct our own vetting and screening process, which we will then go through the case and interview. And it takes another, to even get to this point, takes at least 7 years. And then it takes at least 2 years to get through the United States process. Anybody who's committed serious crimes or who might pose a security threat are not eligible for refugee status or resettlement. And of course, the important thing to keep in mind and to know about refugee resettlement is that it saves lives. And it is, again, not the first option. There's a slide, and it's not in this one, but it says the 3 solutions for the refugee crisis is, resettlement, integrated, or for them to go home. Ultimately, though, it's how can we prevent? I come from a prevention background, and it's, I think, again, this is a humanitarian effort, and how can we really work together? World peace, who knows, but right now we have to deal with the refugees and the asylum seekers who are at our front door. So to wrap all that up, how do refugees get to Savannah? A refugee will leave their home country and they register with the United Nations. The United Nations refers the refugee. We will screen them. They go through 5 different security bases, 6 background checks, 3 in-person interviews, and if they're approved, the State Department sits down with those 9 resettlement agencies, and then they start to assign cases, and then we, Inspiritus, here in the city of Savannah, we get a notification that we have a new case, a new arrival. We find out when they will be here, and then we drive over to the Savannah Hilton Head Airport, and we welcome a family into Savannah and start the process of resettlement. And everything I just covered is so much, right? It's wow, what did they go through to even get to this point? And now they start the long journey of integration into the United States, which is a whole nother journey in and of itself, right? To thriving and to help them find their strengths and their resilience as they grow into their community. So within the first 90 days, and this is what happens across the nation in refugee resettlement. In the first 90 days, the first 3 months of a refugee's time here, we connect them to community resources that they need in order to begin a new life. Everything you can think of, right? But there, of course, are core things that we have to cover. We enroll them in ESL classes at Savannah Tech. We find employment for them. We advocate for livable wages, and we make sure that they do. We enroll their kids into the school. We connect them to friends and mentors in the community, maybe like yourself. We teach them the bus system. We enroll them in healthcare and guide them through their health plans. We work with Curtis V. Cooper to get their initial health screenings, and then from there, I will say a lot of our clients do come with high needs. Or medical, or just regular medical needs too, and it's just navigating that system, very difficult. Heck, I am not a case manager. I cannot tell you a lot of what our insurance, they have to understanding. We enroll them with in public benefits, so they do have access to benefits and to food stamps and to all of that to get on their feet. We secure housing for them. It's really connecting them to everything that they need in order to go from surviving to thriving. This period is called reception and placement, and it's funded by the Department of State. We have a contract with them called the Cooperative Agreement, which outlines certain core services that we must provide within the first 90 days. And of course, we provide those core services But as you can imagine, there are a lot of support services that are needed during and after that time. So after 3 months, don't worry, we are still there to support and to provide guidance and assistance with long-term goals, immigration assistance, ongoing mentorship, health promotion, all that good stuff. And we are still building up our capacity and building up our programs to provide even more support. And again, that's where volunteers in the community really help us with the work of welcome. Because again, our job is to connect them to resources in the community. And then to eventually, it's not us providing the services, we're connecting them to the service providers. And oh my goodness, sorry, my cat. Zoom world, right? So we're connecting them to core services and then guiding them and helping them to self-sufficiency is our huge goal, and to be self-sufficient within these systems and to learn. But when you don't know the language or the culture or the norms, and you're not used to the bureaucracy of like each system that we deal with, you know, I mean, it's a lot for us, like natural born citizens, much less, you know, those that we welcome. And so having those friends and mentors, it is so important, in having strong partners who are truly partners with us in this work, that we're not just handing, you know, that we're working in partnership with the school and in partnership with Curtis Cooper to make sure that we are providing these services. And so the cooperative agreement, you know, our goals, the performance outcomes is that at the end of the 90 days, we want the refugee to be in a safe, stable environment. We want them to be able to navigate appropriate and relevant systems. We want them to feel connected to ongoing support for themselves and their family. And we want them to understand their surroundings and their situation. And of course, knowing that they have a safety net. If they have questions, you know, we are there to guide them, to show we really have this, let me see, we really have this idea of promoting self-sufficiency, that we are centering the client in their capacity. They can, you know, it is a lot to navigate, but they have the strength, they can do it. And we just empower them, and we give them the tools and the resources, and like, you know, just the morale boost to get through this and to make these connections and to be part of that work. I mean, it is honestly like the most beautiful thing ever, to be a part of that empowerment. And I think sometimes, you know, I manage volunteers, and I really push on the volunteers that we have to do things with and not for our clients. And you know, sometimes it's easier when you go into the doctor's appointment just for you to have those conversations and you to do the appointments and the check-in, but to like really guide our families into each of these systems, even going into the grocery store for the first time. You know, like why, like there's so many choices, and it's the supermarket, it could be a lot to navigate, but really empowering them to do it on their own. And so we have a model where we do things with and not for, and we model, and that's so that we can truly promote self-sufficiency within them. And then a lot of folks, they come and they have that attitude, you know, they're like, let me do it. There's some people that they're not used to Western culture at all. So there's a lot that we do have to just, and here we have to respect cultural differences. There's not a right or a wrong way to do it, but there are certain ways that we do things in the United States that if you really are going to go from surviving to thriving, you know, we want to make sure you have those tools and resources. And so, of course, we protect our refugees' confidentiality. A lot of them still have family back at home that are at risk. And I didn't say this, but I wanted to, speaking of family back home, is that, you know, our refugees are so happy to be here, but every single one of them would rather be back at home if they wanted to. So I think sometimes it's, you know, it could be humbling because it's like, yes, they're so happy to be in the United States, but at the end of the day, they would like to be back home with their family, united. And we have a trauma-informed care, of course, doing this work as well. And you know, and we work with a lot of, like, we work with mental health care providers. Thankfully, it was just it was really wonderful to see how many, especially the Afghans that we dealt with, were really open to mental health care. That was really exciting to see. So just wrapping up, so we have time for Q&A. Here are some opportunities. Like I said, of course, I would love for you to get involved with the work of Welcome, to be a first friend. There are so many ways to get involved. You have knowledge and experience that I guarantee one of our refugee families needs that. So there's so many ways to get involved. We find housing, we secure housing, but we also set up the housing. So we always take donations, furniture donations, household donations, and then we set up the housing. If you are good with job development, job coaching, we always need that assistance. We have an after-school program where you can tutor. If you are an ESL teacher, you can help out with the English learning. There's just, you know, I can go on and on. We also work with organized groups, a lot of times faith-based groups, who will actually work to what's called co-sponsor a family. And that's just working specifically with one family for a committed time period. And then you're really involved with the work and able to, like, build those relationships. It's very, we could not do the work that we had, about 9 co-sponsors, most of them congregations throughout the community. And I tell you what, we could not do what we do without volunteers doing all of this and filling in the gaps for each family that we welcome. And so I do want to mention briefly that, just because especially the federal government recently made an announcement that there is this new program called Welcome Core, which is a private sponsorship. So I just mentioned co-sponsorship, which is in a partnership with us, the local resettlement agency, and you work with us to co-sponsor a family to do the work. Private sponsorship is when a community group takes on full responsibility of providing all those services. This is a model that they did for Uniting for Ukraine. So of course, this past year with the Ukrainian crisis, and I should have the number, but the Ukrainians were given humanitarian parolee status that they had to apply for, which, you know, that's a whole process in and of itself. And again, this is a temporary status for an emergency situation. The Afghans were humanitarian parolee status, but they were through the refugee resettlement program. The Ukrainians were not, as a private sponsorship, so a lot of the times it was families. But we have seen, now we actually have a Ukrainian case manager, and it's her job to help the sponsors do the work, because a lot of the sponsors were not able to provide all the services. But because, again, each year our admissions rate, the support goes back and forth. And so in order to encourage sustainability and build our capacity of Welcome, the federal government is now rolling out a brand new program called the Welcome Core, which is a private sponsorship and is now an opportunity to welcome any refugee seeking freedom and safety. And so it would be a community group taking on the full responsibility. Everything I just said that we do, you would do, or the group would do. There is training, that you would have remote assistance along the way. And Inspiritus, we're not sure exactly what our role would be in that, but I just wanted to put that in there because I've already started receiving questions about that, and we're still learning about it. So again, there are so many ways to get involved. You can volunteer, you can donate, and you can advocate. At the end of the day, you could just be a welcoming neighbor to everybody that you see, because you don't know, we don't know what anybody has gone through, and we could be a good neighbor to everybody at the end of the day. So thank you so much for allowing me to come and share the work of refugee resettlement and welcome. And I'm happy to answer any questions that you may have about this. And I didn't include my contact information slide, but I can definitely share that if anybody would like to stay in touch with me.
Well, thank you, Ms. Grovenstein. We appreciate tremendously. I for one learned a lot today. So the floor is open, or I should say the call is open to anyone who has questions. Dr. Jeff Jones.
Thank you so much for your presentation. I live in Savannah and I would be interested in contributing in some way. Can you put in the chat box your email, or maybe Dr. Telfair will share it, but I would like to send you mine and see if there's some way I can help. This is something that is near and dear to my heart.
Absolutely. Thank you.
Thank you.
All right, so it's in the chat box. Anyway, thank you, Dr. Jones. Anybody have any comments or questions? Dr. Ho-Tang, you want to say what you shared in your comments, as well as Dr. Chopak? Do y'all want to say anything?
Oh yes, I just thank you for sharing your wonderful work. And I was just curious about what kind of public health issues those refugees, especially the resettlement center in Savannah, will face. Commonly seen, some major public health issues like disease or infections. Yeah, I'm just curious. Thank you.
Yes, of course. So that's a great question. Let me see. Well, for like public health, a lot of our refugees are coming with health issues, and a lot of it is stuff that has been like care that has been delayed on certain things. And I'm not as privy to the specific, because there's so many families, right? But a lot is, we do have a lot of ongoing health issues. And now that I'm trying to get specific, it's so hard to navigate, because we know that once you go to Curtis Cooper, you're receiving specialists. You have to go to this place, and you have to go to this place and this specialist. And so I think just like navigating navigating that healthcare system is so difficult for people. We have a lot of pregnancy and like kind of issues with that. If I would have to find out specifically if there's any like common overarching like diseases or like certain conditions that keep coming up. But I know a lot that we saw was like people who had like shrapnel in their arms and they just had it there for a long time, or injuries. We had one lady who had like this dermatologist. She kept seeing them, and basically she just had these calluses on her hands. And I think it's just from years of like manual labor. And so I think a lot of it too is like health literacy and like learning what Western medicine can do and like what we can't do. And there's a long conversation, and we're working on partnerships to just kind of help our clients navigate their conditions, because of the specialists and all that, it can be a lot. Sorry, that's a rambling question. It's kind of hard to answer.
Thank you.
So I just to follow up on that question, in terms of the networking that you do in terms of referrals, there is a really good system in the city of Savannah and in the county of Chatham, and that includes FQHCs, that includes the public health department of the city and so forth. Does the work that you all do, is that part of that networking?
I'm unsure. I would have to follow up with like the management to see if they have something like that. But just from my experience, I do feel like I would say no, but I feel like we could. But in my experience, it feels like either once they leave our care, because too, it's like our job. At the end of the day, our job is to connect them. Our job is not to technically to manage like the health plan. And so I think sometimes there's just, we will, and our case managers do now, like they do, but then I think they'll take it on anyways. It's a long sprawling question. I would love to be connected though, Dr. Telfair. Maybe you can give me more information.
Yeah. So I mean, the network like the CGIC, Healthy Savannah, those groups, with the, and the Chatham County Safety Net Council, all of those are groups that work with the citizens. and all of them are very well connected. You know, one have 100+ CBOs, NGOs, those groups. And so it would strike me that with the refugee community coming in, that the diverse needs as well as the diverse talents of those persons, would in and of themselves would work, because that, that's one of the things about a lot of the refugees is that a lot of them are professionals in their own country, and so bringing that to the community here, and then linking them with the community as well as that. So the other services you mentioned, which are many, but also just what do you do to establish the long-term life after your time? And some of that, I'm guessing, as you have shared, which I understood, but wasn't as appreciative of, is just the government bureaucracy around these things. And the very fact that we don't have a really good immigration, plan at the national and even at the state level. So, okay. All right.
Yeah, and I appreciate that. I think, because in my previous position, I was connected to those groups, and what I found when I started this, though, that the amount of the Afghan allies, we receive a new family every other week. Actually, we have a busy season coming up, but we were receiving multiple cases a week, and so I think we were just really caught in just a reactive mode, and we had to be. It was an emergency situation. And so now after that, we're kind of stepping back to be like, okay, there probably were these connections, and I have made these connections, but I think it's like the asks can be big and we have to be strategic, and we are now entering into a phase where honestly we have time to be strategic now that we've all been doing the work for a year. Because like I said, it's just it not like we're a new office, but essentially it was like it felt like starting from scratch in the Savannah office. We did have some partnerships that were still pre-existing throughout, but it was very limited. So that's why I'm just so excited to be a part of sharing the work, doing more outreach now, and so I'll be sure to plug in to those places more.
Yeah. So in public health, we pride ourselves on the prevention. It's just not primary prevention, but secondary prevention when there's challenges in the work. And we apply that on the social context as well, in a social cultural context as well. So I think when you hear from the public health persons, that's kind of his approach. So that's why our questions are in that direction, because the holistic view of the person is a core of what we focus on in public health. So
yeah. Well, again, would love if you want to stay connected. If that's just, I think there are so many opportunities. The needs are many, but that means that our opportunities and solutions are many as well. And so there's to just get involved with the work. And again, you probably see, if not a refugee, I think it's just I could go on about immigration work in general, but we're seeing a lot of folks don't get refugee status, and they still have to come in, or there's more parolee statuses that are coming out now. They don't have the same access to care. So just something to keep in mind.
Yeah.
Thank you so much.
You're welcome. So we appreciate that. Okay. Any other comments or questions from the people who are still on? All right, then. So Ms. Grovenstein, we thank you tremendously for sharing the just this excellent, inspiring work that you all do. And our hope is that we will find a way to connect and get our persons involved with you. So as a reminder to everyone, this session was recorded, and we've asked Ms. Grovenstein to share her slides with us, and we will post those along with the presentation and her contact information as well. So we thank you all for your time and your willingness to listen today and participate today. And if you have any questions, I'm sure Ms. Grovenstein will be happy to follow up with you. So thank you, everyone. And Ms. Grovenstein, you have a great thanks for speaking with us and sharing your work. Okay, everyone, have a good rest of the day. Thank you.